Everyone. Thank you for joining us. I'm Mary Stein. I'm with Parker Phillips. Just a reminder as we start the meeting, if you could please mute your screens and we will get this event underway. I'd like to introduce Dr. Harriet Okach.
Good morning, everybody. It is my delight and my pleasure to welcome you all to this event, which is the launch of the Lead-Free Promise Project. Just to give you some background about that, this is a statewide coalition, a statewide initiative that is built on the premise that we can end lead-based paint poisoning in Pennsylvania. This coalition is made up of 37 organizations and still growing. And I am so fortunate and pleased to be one of the leaders of this coalition. And I work very closely with Colleen McCauley, who's the co-chair of this, and she's the Health Policy Director with Public Citizens for Children and Youth. I just want to share with you a little bit about the goals for this initiative, just to put us all into the same space and understanding. So we have 3 goals for this initiative. The first one is to get lead-based paint out of the homes in Pennsylvania, and to do it now. Now is the time. And we would like to, reach out to the governor and legislators and think about using the funds from the American Rescue Plan Act to do that now. But also thinking long-term, think about how do we generate dedicated revenue of state funding to do this. Our second goal is that we would like to get more babies tested for lead. We would like to guarantee that in their childhood, children get at least 2 tests, 2 screenings for lead. And our third goal is that all those children who are then found to have been exposed to lead, we would like to get them into services early, so early intervention services that can at least hold for them the promise that their lives should hold. And we have a very, very exciting lineup of speakers today. And without further ado, I would like to introduce you all to Ms. Sandra Ortiz, who is a parent of a child who's been exposed to lead. Ms. Ortiz, would you like to share with us your story, please?
My name is Sandra Ortiz, and I'm the proud parent of 3 little kids. We live in a small town of Mifflintown, Pennsylvania, and Juniata County in the center of the state. When I took my second child, Katie, into the doctors for her well child check when she was 18 months old, they tested her for lead, and the test came extremely high at 57. 5 is the minimum level for poisoning, and Katie's level was 11 times that. I was very worried that Katie would be okay. Her lead was so high, she was hospitalized for 3 days in Danville, an hour and a half away from her house, for an urgent treatment to try and get some of the lead out of her body. I was told she could have brain problems and problems moving her body. To make things even worse, my doctor called Child Protective Services to see if we were treating her right. I didn't know how she got poisoned in the first place. I was so scared. I was also confused. I asked myself, what even is lead? Because this was the first time I have heard about it. Shouldn't we have been told the house has lead when we bought it? What I learned was that the answer is no. Lead tests are not required in Pennsylvania when you're buying a house. Well, I did my research and I asked a lot of questions so I could help my daughter. We have medical assistance health insurance, and it is supposed to pay for home lead testing, but it was a struggle to get that done. When we finally got the house tested, we believe Katie was chewing on the windowsill in our living room, which tested high for lead. Several other spots in our house tested high, and we were told it would cost thousands of dollars to fix everything. there were no programs to help us afford to get the lead out. So we did a lot of ourselves. We removed carpets and replaced them with new smooth floors, and we repainted the entire house. We also bought a special vacuum to help safely get up any lingering lead dust. I'm trying to do everything in my power to help. It has been very hard and tiring. We took her to the doctors and she cried and screamed every time. I still have her, I still take her for regular appointments to test her brain and see how she's developing so we can detect any problem. Right now, she's pretty good with everything. She's pretty smart and we haven't seen any changes. But I'm concerned because I know lead stays with you. So there's still a chance she could be impacted in the future. We shouldn't have houses in Pennsylvania with lead in them because any baby could possibly come into contact with lead. We could require, we should require older houses to be tested for lead. And families need more support. Right now, there are not many resources to help people who don't have the money to get let out. I don't want any other parents to have to go through what my family is going through. We have to make sure children are safe, and we have to do it now.
Thank you so much, Ms. Ortiz. I should say that Katie is very fortunate to have you as her mother, and to say that the Lead Free Promise Project really wants to work with parents and caregivers like yourself to ensure that children like Katie, all those kiddos out there, do not have to go through what Katie's gone through. So thank you so much for sharing your story with us. I would at this point like to welcome to the podium the Acting Secretary of the Pennsylvania Department for Human Services, Meg Sneed.
Good morning, and thank you to Dr. Okach for the introduction and bringing us together on this important topic. Lead exposure and poisoning are preventable, and as our communities and infrastructure age in Pennsylvania, we must be cognizant about potential risks in our communities, especially for children. Even low-level childhood lead poisoning can interfere with a child's physical and cognitive development that can lead to behavioral challenges and delayed development. Exposure can affect health outcomes into a child's adult life, and high levels of lead poisoning can also be fatal. Too many children in Pennsylvania experience lead poisoning every year, and higher rates of lead exposure among children are more likely in Black and Latinx communities. This disparity can fuel intergenerational health inequity throughout a person's lifespan. We need to work across systems to identify exposure, provide support necessary to help affected children, and ensure that families have assistance identifying the source of exposure and remediating the problem to protect the entire family moving forward. Blood lead screenings are necessary to identify potential exposure in children, and the Department of Human Services works closely with our Medicaid and Children's Health Insurance Program managed care organizations to make sure children covered through these programs are receiving these screenings. Early identification of potential lead exposure is necessary to help children and their families connect with assistance and services needed to address this exposure early and avoid further health risks and complications. Blood lead screenings are offered in line with recommended pediatric screening schedules for children covered through Pennsylvania's medical assistance and CHIP programs. An incentive and pay for performance programs are in place in both MA and CHIP to support providers and managed care organizations that are able to meet goals in adherence to recommended screening schedules. We need to be sure that these screenings are happening so families are referred for interventions and services as quickly as possible, and incentivizing our partners in managed care and providers helps us work towards this goal. The Federal Department of Housing and Urban Development recently announced a grant opportunity that can provide county and local governments with $1 to $5 million in funding to support lead remediation efforts stemming from use of lead-based paints. A study published by the National Institute of Environmental Health Sciences once found that investments in lead remediation help protect children and families, offset costs related to special education, physical and behavioral health care spending, and crime in communities most affected by lead poisoning. I encourage our local governments and counties to take advantage of this opportunity to support lead remediation efforts in their communities. In the coming months, Pennsylvania's school districts and charter schools will receive shares of nearly $4.5 billion in emergency funding through the American Rescue Plan Elementary and Secondary School Emergency Relief Fund. Schools can use these federal funds to address the impact of the pandemic on students and to safely reopen and sustain safe operations. This includes applying funds towards the remediation of lead in their buildings, which we know negatively affects indoor air quality and creates unsafe drinking water. The Pennsylvania Infrastructure Investment Authority, or PENVEST, recently launched a voluntary lead testing program for eligible schools and childcare centers to receive free lead testing and related training and technical support. Since February, more than 300 schools and childcare centers have enrolled in this EPA-funded program, and additional spaces are available. To learn more and enroll, I encourage you to visit leadfree.pa.gov. As our state's homes, schools, and infrastructure continues to age, we must recognize the value of this investment in helping children across Pennsylvania have the healthy life they deserve. Thank you again for allowing me to join you all today and for your advocacy and work to protect Pennsylvania's children and families.
Thank you. Thank you so much, Secretary Sneed, especially for highlighting the grant opportunities that are available. And I hope that attendees on this call will take advantage of those. I also really would like to appreciate you for bringing up the fact that we do have old housing, which is a risk factor. And more importantly, that lead poisoning is a health equity issue that we all need to pay attention to. So thank you so much for your remarks and your words. So now I would like to welcome the Honorable Jim Struzzi, who is the PA State Representative from Indiana County. Welcome.
Thank you. I really appreciate the opportunity to be here today. I think that lead is one of those issues that really people don't think about these days. And I appreciate Ms. Ortiz sharing her story, because I think that really highlights what can happen when you purchase a home and you don't realize that there is lead-based paint. I have 4 children of my own, and I didn't think about that when we purchased our home, and I'm sure many people don't these days. So with this project, I really appreciate the efforts to increase awareness, because I think that's really the key to solving this problem. And it is a solvable problem. It is truly something that any family should not have to deal with, because in today's day and age with the testing, we should be able to address this problem and resolve it. And in no way, shape, or form should our children be exposed to lead in 2021. So I think it's vitally important, the efforts of this group. I appreciate the opportunity to be part of this, and I'm pledging to do everything I can to help do what we can to mitigate lead in homes and in schools and in public buildings. I really wasn't aware of the issue. And thanks to Colleen and the team, met with me, several months ago. I said, that's surely not a problem here. I represent Indiana County. We're somewhat rural. And then when they showed me the numbers, the number of children that are exposed to lead poisoning every year, I was shocked. And I think that, in this world we live in today with the pandemic and everything else that's occurring, it really isn't a top of the mind issue for many people. And yet here we just saw an example today of what can happen. And I truly feel for Ms. Ortiz and her family, and any family that's exposed to this, when it's simply something that they could have been made aware of when they purchased a home. And I see no reason why we can't do everything in our power to make this a problem of the past and move forward and truly provide a healthy learning environment for our students and for our families moving forward. So again, I appreciate the opportunity to be part of this press conference, and I think it's vitally important that people are aware that lead is still out there, that lead poisoning is occurring across this Commonwealth, and that we do have the power to end that, though. So again, thank you for the opportunity to speak today, and I appreciate all of your efforts, and I look forward to working with you to solve this problem. Thank you.
Thank you so much, Representative Struzzi. That was very succinct and yet so powerful. You talked about the fact that this is not just a historical issue, it's still present with us. You talked about the power of having data, and that is where awareness can begin, when people see the data and they realize that this is still a today problem. But more importantly, you highlighted the fact that awareness is the beginning of action, right? So once we are aware, then we can act. So thank you so much for powerfully summarizing this issue of lead poisoning and being here to encourage us to keep doing this great work. So right now, I would like to pivot and have a different perspective, and I'd like to invite a pediatrician, the chair of pediatrics from Penn Medicine, Lancaster General Hospital, Dr. Frances Gross.
Good morning, everybody. Making sure I'm off mute. It is absolutely my pleasure to talk to you all. I'm a pediatrician practicing in Lancaster County. I've been here for 34 years. And I do want to take this moment to truly thank Sandra for highlighting the stress and frustration as a parent dealing with a child with lead poisoning. And I want you to know, Sandra, that your pediatricians and primary care physicians are all as frustrated with lack of support and resources for our parents and their families. And hopefully this will change. So our county is known for its historic heritage and home to the oldest Amish settlement in America. Lancaster City was settled in 1709. What many of you don't know is that we are the youngest county per capita in the state for children 7 and under, and we rank 4th in the state for the highest blood lead levels. Lead poisoning in children is a silent epidemic, and I want to tell you that I feel we are in a new lead poisoning epidemic, especially due to COVID and stay at home. And because the chronic symptoms are very subtle in children, it's difficult to pick up by clinical assessment. Until the symptoms become severe, which may be brain swelling, vomiting, seizures, these symptoms only occur when the lead levels become critical. In the early stages of the disease, the child's only hope is to be screened during a routine screening and found to have an elevated blood level, hopefully in the lower range, that will ensure that environmental action can take place as soon as possible. So as mentioned, universal screening is recommended by the CDC and American Academy of Pediatrics. 2 screenings by the age of 1, and then a second at age 2. And then of course, blood levels are followed if any of those are elevated. Once young children accumulate the ingested or inhaled lead in their body, it is rapidly absorbed into their brain, their bones, their kidneys, and this is irreversible. It causes irreversible damage. There is no treatment to reverse this, and there is no cure, and it will continue to cause long-term damage affecting their growth and neurodevelopment. So, sadly, I am to report today that we just admitted our 2nd child with lead poisoning at our pediatric unit at Lancaster General. These 2 young children were picked up with screenings, but both had very delayed well child visits, again, due to COVID and lack of healthcare availability. So the first child was a 19-month-old with a yesterday's admission was a 19-month-old with a blood lead level of 52. 3 weeks ago, a 3-year-old with autism and gross motor delays had a blood lead level of 112. 112. Keep in mind, 0 to 3 is the current acceptable blood level. This 3-year-old little boy received combination chelation therapy and was discharged with his mother to a motel as they could not return to their city apartment. And currently they are staying with relatives until lead abatement in their home is complete. As of yesterday, they are still displaced. The 19-month-old also lived in Lancaster City, and that both of these children are our homes are in our Lancaster City, which is have our oldest buildings and dwellings. So I leave you with these final facts to remember: that lead poisoning is a preventable disease. There is no safe blood level. The safest level is 0, and you cannot reverse lead poisoning. And the only treatment for lead poisoning is prevention. Thank you all.
Thank you very much for the medical perspective of lead poisoning, but also the hopeful message that this is preventable and we get it out. And if we don't get it out, we should be screening children. So these are all very important messages. And I still can't believe that we have children with 112 micrograms of deciliter levels. At this point, I'd like to move on again. I did say we had a great cast, right? And we've just heard from a healthcare perspective, and now we're going to move to a different perspective, which is law enforcement. And so at this point, I'd like to welcome the Chief of Police from the city of Bethlehem in the Lehigh and Northampton counties, Michelle Cott.
Hi, everyone. Good morning. I appreciate the opportunity to participate in this important event today. I'm Michelle Cott. I'm the chief of the City of Bethlehem Police Department, which is located in Northampton and Lehigh counties. More importantly, though, I'm the mom of a 7 and a 3-year-old. So this is a matter that's extremely near and dear to my heart. I'm a member of the Fight Crime, Invest in Kids organization, which is a statewide nonprofit entity of 250 Pennsylvania police chiefs, district attorneys, and sheriffs who protect public safety by promoting solutions that steer kids away from crime in the first place. So rather than being reactive, trying to be proactive. Make no mistake about it, law enforcement will always hold people that break the law and victimize others accountable for their actions. But the Fight Crime, Invest in Kids organization believes that being smart on crime means preventing it from happening in the first place. Today, we're talking about something very basic, the safety of a family's living environment. Childhood lead poisoning is an insidious threat that in too many cases goes unnoticed or unaddressed. A recent report released by Fight Crime, Invest in Kids summarizes multiple studies showing connections between childhood lead exposure and future learning disabilities, behavioral issues, problems with impulse control, and even committing future crimes, both as a juvenile and as an adult. One study found that as blood lead levels increased, so did that of the risk of being arrested for a violent crime in young adulthood. And for every 5 micrograms per deciliter increase in the level of lead in a child's blood at age 6, their likelihood of being arrested for violent crime as young adults increased by almost half. Another study linked preschool blood lead levels with data on detention rates for 120,000 children born in Rhode Island between 1990 and 1994. I'm sorry, from 1990 and 2004. The researchers found that as lead levels increased, so did rates of suspension from school and juvenile incarceration. Other research is compelling as well. A longitudinal study of the relationship between lead exposure and crime found that populations that had lead in their drinking water had higher homicide rates after 20 years compared to areas where lead was not present in drinking water. Yet another study found that children who were exposed to lead in early childhood committed, on average, nearly 5 times more delinquent acts as adolescents than their peers who were not exposed to lead as children. These numbers and studies are sobering. And as a law enforcement leader, these are unsettling outcomes to me. It says that my colleagues and I in law enforcement are literally going to be fighting and dealing with preventable crime in the future because as a society, we haven't been able to adequately prioritize elimination of the lead hazards young children are exposed to through no fault of their own. Childhood lead poisoning is preventable, but far too prevalent across Pennsylvania. Research is clear that childhood lead poisoning increases the risk of children engaging in later criminal behavior. Investing in childhood lead exposure, testing and remediation of lead paint in homes will make our communities not only healthier, but also safer. Thank you.
Thank you very much, Chief. That indeed is very sobering, listening to all those numbers and that data. And I do fully agree with your statement about us being smart on crime, meaning preventing it before it starts. What way to do that than getting lead out of the homes that our young kids live in? So thank you so much. I would like at this point to welcome Steve Metzger, who is an instructor at the Finishing Trades Institute, which is affiliated with District 21 painters and allied workers. Steve.
Good morning. As you just heard, my name is Steve Metzger. I'm a health and safety instructor for Finishing Trades Institute. We do all the training for the International Union of Painters and Allied Trades, District Council 21 here in Philadelphia. I have Dave Tomczak, he's our health and safety director here with me. We represent approximately 1,500 painters in southeastern Pennsylvania. I'm here to discuss the creation of the lead-free promise and the funding for it would not only eliminate lead conditions that can be extremely harmful to small children, as we heard, and possibly lead to crime, which is very, very interesting to hear, but done properly by the right individuals who are trained. The training which we do, EPA training, lead removal training, remediation. So far, Dave told me we've trained 131 individuals this year. The proper removal of lead paint in housing is vital, right? So the people need to be performing these tasks, need to be properly trained. Our painters go through an apprenticeship and have years of paint removal training that's really nailed into their head as time goes by. So really the point I'm trying to get to is effective lead remediation is the key, right? In order to properly protect children, prevent crime, and all the stuff we're looking for. Here in Philadelphia, as you know, our state, Philadelphia, local stuff, Allentown, Reading, a lot of old houses, a lot of old buildings. 70% of the housing in the state was built before 1978, which is the year lead-based paint was banned. So unfortunately, it's not always lead paint chips that can be the issue, being consumed or eaten. Renovations, repainting of lead paint. Lead paint, once it's in a house on a wall, is a hazard until it's properly removed. A window replacement in a house can expose a child to lead paint. Removing countertops and cabinets in a kitchen can remove enough lead paint to harm children in that house. Any sort of renovation. So that's why it's important to identify lead paint in these older houses and have it properly remediated. Okay, so we know the importance of removing it. What it would do for us, when I say us, the painters that we represent, it would create jobs and good jobs with good paying jobs with benefits. We have a lot of members who over the past year, got over a year, 15 months now with this pandemic, have been affected big time by the shutdown. And I think creating this, funding this, creating jobs, having the proper people in there working, performing the work the correct way, will protect children and help these workers get back on their feet after the pandemic, help their families along with the families of the house that they're working in. So I think that is, to me, one of the most important things. Like when we do our training, we try and touch on the individuals, all the reasons we just heard. How dangerous is the child? I have small children. Dave has small children. That's the first thing we ask when we do the training is who has small children and how important it can be. So when we focus on the training, we focus on how important it is, not only to do the work and do it the right way, but to protect the people that you're kind of charged with helping to remove this hazard from their house. In Philadelphia, the Philadelphia Housing Authority has received funding from HUD to remove this. All our guys and girls down at the Housing Authority do this lead removal already down there. And those houses to any other houses would be an easy jump to make sure it's done the proper way and the correct way by the qualified people and the right people to do it. Thank you. I think that's all I got.
Thank you so much, Steve. We really appreciate that. I think the important thing to take out of that is the fact that with lead remediation, we're creating economic opportunities. And right now, we all know how COVID has been detrimental to the economy. So an opportunity like this at a time like this, really to seize it, to not only protect the over 8,000 babies who get lead poisoned annually in the state, which is enough children to almost fill the PA Farm Show House, complex to capacity. And also to think about that this is actually a much higher rate than the kids who were poisoned during the Flint, Michigan incident. So we really do see that this is something we need to get onto. And how beautiful would it be if we can protect our children while at the same time boosting the economy. So thank you so much, Steve Metzger, for that. I would like at this point to invite Jordan Casey, who is an attorney with the Health, Education, and Legal Assistance Project, which is a medical legal partnership at Widener University.
Great, thank you so much for having me. And a special thank you to Sandra for sharing your powerful and important story. And I wish the best for you and your family. So, good housing is good health. Our health is therefore, in no small part, dependent upon our ability to reside in homes that are safe and free from physical hazards. While the law is positioned to protect the renters I work with from the obvious physical defects in a property that impact health, like a lack of potable water or lack of heat in cold weather, the legal protections fall short when a renter is faced with equally as injurious conditions like chipping or peeling paint. With the absence of any real statewide or local protections like lead-free or lead-safe laws, it shifts the burden to landlords to provide a safe and healthy home. Tenants, who are often poor and living in older declining housing stock, are left to reside in homes that are riddled with lead hazards, poisoning their children at alarming levels. As Dr. Gross so eloquently pointed out, the COVID-19 pandemic has put these children at even higher risk for lead poisoning because they have been confined to their deteriorating homes in order to slow the spread of the virus. What we need are proactive efforts to get lead paint hazards out of homes first, before children are ever able to be irreversibly harmed. The same proactive efforts that removed lead from gasoline in the 1980s, the same proactive efforts that OSHA used to lower acceptable lead levels in the workplace, the same proactive efforts that the Consumer Product Safety Commission uses to recall products that could potentially expose children to lead. Our housing, the main source of lead poisoning in our children, deserves and requires that same proactive energy and effort. We have a choice here. We pay up front for prevention now, or we pay much more for intervention later. Lead poisoned children often require ongoing and intensive special education, and many are involved with juvenile justice systems. Studies show that for every dollar spent on removing lead paint-based hazards in children's homes and apartments, $17 to $221 would be returned in health benefits. Additional benefits include increased IQ, higher lifetime earnings, tax revenue, reduced spending on special education, and reduced criminal activity. This is a real watershed moment. We have a prime opportunity right now to devote dollars from the American Rescue Plan to help financially with getting lead out of homes. This is an allowable, suggested use of these monies, and Pennsylvania cannot afford to squander this critical opportunity to provide children and families in the Commonwealth with the safe and healthy homes that they deserve. Thank you.
Wow. Good housing is equal to good health. I love it. I love it. We have heard from legislators, we've heard from health sector, the legal sector, from the construction industry and law enforcement. It's been really beautiful. So what I'd like to do now is invite Dr. Tom Vernon, who's a retired public health physician and also the former board chair of the National Center for Healthy Housing, to just wrap this up and close for us our press release today. Thank you so much, Dr. Vernon.
Thank you, Harriet. I am disheartened when I hear stories such as that of Katie Ortiz and of the two patients that Dr. Cruz has told us about. Jim Struzzi was shocked at the numbers. We've used the number 8,000. But I must tell you, I am really heartened by the opportunities that we have ahead of us. I believe in Pennsylvania, this could be the beginning of the end of an epidemic. Again, the analogy that Dr. Gross has mentioned, let's think of it in terms of an epidemic, a pandemic we have come to know so well. The virus, it's lead. The susceptible target population, it's our children, but especially those children who are in families in financial hardship, disproportionately Black, colored otherwise, and poor. Does that sound familiar? There are the long-led consequences of this virus, the learning difficulties, the aberrant behavior problems referred to so eloquently by Chief Michelle Cott. The vaccine to this epidemic is the determination and the will to enact policy and to dedicate the funding to address the epidemic. We did it with gasoline. It was shamefully late by the time we actually accomplished it, but it made a difference. So we need a warp speed on the next step. It's not going to be speedy, but it is the remediation of homes where old lead paint continues to poison children. The vaccine opportunity sits, in fact, before us. It would be the investment of $40 million from the ARP funds available to match the HUD lead remediation funds already available in Pennsylvania. I believe we're on the cusp of doing something big in Pennsylvania to protect our children. Something that could even be a model for other states. The Lead-Free Promise Project is that idea and that impulse and that program. Let's do it. Harriet, thank you.
Thank you so much, Dr. Vernon. That was a perfect way to end this. Beautifully summarized and a great call to action. We have over 100 people on this call who are here because I believe stand on the same promise, right? The Lead-Free Promise Project, that we can get our children safe. What I would like to do now is to open up to field any questions that you might have, and I'll invite Colleen McCauley to help me respond to any questions that will come. We might not get to everyone's questions, so if you put questions in the chat as well, we will do our best to combined similar questions in our responses.
So yes, good morning. I'm Colleen McCauley. So if there are any questions from the press, we would, for our panelists, we would love to entertain them. Thank you.
I had a question. Joe Locasano from Department of Education, Safe Schools Office. On my end, it's pretty narrow. I get people submit any data to me from schools when they do lead testing in drinking water, which right now is voluntary. So that's pretty narrow. I just entered the data. But widening this out a little bit, I see today's discussion is kind of focused on, well, you see, I see the paintbrushes behind you, and the focus seems to be on lead paint. But is, and again, I'm not an expert on this, the possibility of the lead poisoning appearing, I think someone mentioned in, well, I mentioned in drinking water as well. But I'm thinking of the Commonwealth of PA. Is there a relationship there, not only in the urban areas with the lead drinking water and the paint, but what about in those large, I call them the coal regions up there in the Northeast? Is there a relationship between the old coal mining process, whether recent or old, and lead in drinking water? I'm just kind of taking a half-educated stab here.
So Joe, thank you for the question. It's true, our focus this morning is on lead-based paint. That's the #1 way that children in Pennsylvania are injured by lead, and in fact, across the country. There was a reference to Flint, Michigan a few years ago, the tragedy there. That was a more unusual situation with the corruption of a water source in that city. So there shouldn't be lead anywhere, right? In our water, in our paint, in our homes, in our schools. But the #1 way that children are injured in Pennsylvania, it's babies who are injured. These are 8,000 children who are mostly under the age of 3, is in their homes by deteriorated lead-based paint. So thank you for that question.
They're eating the paint. So do we touch on the lead and water, or this group is focusing on the paint part? I would imagine.
This group, thank you. Yep.
Okay. All right.
Thank you. Are there any additional questions? Oh, go ahead, Mary.
Oh, Representative Sterla, did you have a question?
Yeah, well, a question and a comment, I guess. In Pennsylvania, I'm a landlord. In addition to being a state representative, I have a couple apartments. And every time I rent an apartment, I need to sign an affidavit that says, to the best of my knowledge, there's not a lead paint hazard in that apartment. Now, I personally renovated those apartments 30 years ago and know that I removed all the lead, probably not in the correct manner, but they've been, everything's been encapsulated and removed, and I tore out old, everything in them is new. So I can reasonably say yes, but I can also reasonably say yes because I've never had them tested. And so any landlord, unless they have proof that somebody had high lead levels, and even then they can say, well, I don't know whether it was because of my apartment or whether it was something from before or whatever, they can answer yes to that question. So I'm actually working on legislation right now that says anytime you rent a dwelling in the state of Pennsylvania, you have to be able to show a certificate that says it's been tested for lead and whether it had lead or not. Now, 25 years ago, I met with the chief planner for the state of Maryland, and he showed me a GIS system, and he said, here's a GIS map that shows every property in the city of Baltimore that has high lead levels. In my city of Lancaster, where we heard testimony about how high some of the lead levels are, we don't even know where the properties are. And so the de facto process that we use is we use children as canaries in the coal mine. And when they show up in the hospital with high lead levels, we then go out and remediate. That to me is just barbaric. If we did testing beforehand, those kids would never be in those apartments that had high lead levels. So I think there's in one sense, and it doesn't cost the state a dime to pass legislation that says, if you're going to rent an apartment, you have to show that it's been tested by a certified, professional that tests for lead. And even if it doesn't say you have to remediate it, but you have to report it to the person that you're renting to. While that doesn't necessarily solve the lead problem, it makes for an informed public, and it makes, if I have high lead levels in my apartment, there's a good chance that people aren't going to rent from me, because they're going to say, you know what, I'll go to the place that's lead free. And so I think there's a very quick solution we could have to start, and that is to at least require testing in every rental unit in the state of Pennsylvania. So thank you.
Hooray, Mike.
Thank you very much.
Colleen?
George, I see your hand up.
Yeah. I just wanted to actually make some comments. My name is George Gould. I'm an attorney at Community Legal Services in Philadelphia, and I have been involved in lead for almost 50 years. I think this presentation today has been wonderful, but let me just tell you a little bit about what's happened in Philadelphia. Actually, back in the early 70s, I knew nothing about lead, and a young woman came into my office with a young child who looked in very bad shape. And I discovered, she told me that her child has been lead poisoned and the city was suing her to get rid of the lead paint. And she had just purchased a property from HUD. And I ended up joining HUD in the case that the city had brought. And the case got removed to federal court because it was a federal agency. And the court held that it was improper for HUD to sell this property to this woman, and it contained lead-based paint. This was an individual case. We then came together, a group of folks and advocates in Philadelphia, and sued HUD and said they cannot sell properties that contain lead-based paint. And one of the most conservative judges in the federal court wrote a preliminary injunction decision enjoining HUD from doing that. We eventually settled the case, and HUD every year pays hundreds of thousands of dollars to the City of Philadelphia Health Department because HUD will remove lead-based paint in any property it now sells. And the health department goes in and checks to make sure that the lead paint has been properly abated. The other thing we were able to do in Philadelphia, which was a start, and this took substantial amount of time, and Colleen and others were involved, is to get what's called the lead safe certification program passed into law. And that requires in rental properties that if a landlord, before they rent, they have to get what's called the lead safe certification from a licensed inspector that the property is lead safe and it is in compliance with EPA standards. And what they do is go out and do a virtual inspection to see if it's peeling paint, but they also have to do lead testing on various surfaces throughout the house or apartment to determine if there is lead-based paint. And if there is, they have to do abatement of it. And this has been in effect for about 4 years now, or maybe 3 years. And we think it's a start. You know, obviously it'd be better just to get everything remediated. But in Philadelphia, we think this is an important step forward.
Yeah, thank you, George. And there are several other places in the state that have adopted, in Lancaster, for example, in the borough of Columbia, who've adopted some similar policies. And look, we look forward to working with you, Representative Sterla, to get ahead of this. That prevention is our focus. Right, we're going to stop using kids as canaries in the coal mine. Absolutely. Mary, do you see any other questions from the press or anyone?
I'm muted. If there is somebody that would like to ask a question, you may go ahead and unmute yourself.
Hi, my name is Erin Blair. I'm a nurse home visitor with the Philadelphia Nurse Family Partnership for the last 13 years. And I've been engaged in lead advocacy and policy for many of those years because I have watched children become poisoned over and over and over again in their homes. I really appreciate all of the hard work that the Philadelphia Get the Lead Out Coalition has done to get legislation passed, but without funding remediation efforts at the state level, without funding the necessary housing for families that are displaced by lead, we are not just contributing to children being poisoned, we're contributing to families being separated, sometimes by child welfare services, like the mother who spoke earlier. Your child being poisoned in their home by an invisible hazard is not neglect. It is an abuse of the state to not remediate and to not fund the remediation efforts and to not provide families with safe alternative housing while their homes are remediated. And I beg and plead with you to please, 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 please fund more lead remediation. Thank you.
Okay, is there anybody else? All right, I mean, I think that is everything. I want to again thank you all for joining us today, to our speakers for taking time out of your day. We are truly grateful. To our elected officials joining us. Again, we know that your schedules are busy, but this is very important, and we were thrilled to have you here today. If you have any questions, or if you want to have another conversation with Colleen, you can call Colleen or email her. We'll put her information in the chat as well. And again, thank you all for joining us. We truly appreciate your time this morning. Thank you, everyone.
Thank you.